Hello and welcome. You're watching our special show, Coronavirus, Facts versus Myths. I'm Gargi Rao. This is a show where we get you all the latest on the pandemic and also bust all that fake news out there. Our newsmaker today, Dr Naveen Rao, MD Senior VP, Health Initiative, the Rockefeller Foundation. Well, up first on the show, to support the expansion of COVID testing and contact tracing across India, the Rockefeller Foundation announced 2 new grants to the Center for Cellular and Molecular Platforms and Path. The grants totaling $5.5 million will support domestic manufacturing of critical testing materials and increasing testing. To talk more about this, we're joined by Dr Naveen Rao, the Rockefeller Foundation's Senior Vice President Health, to talk about these grants. Thank you so much for speaking to NDTV. So, in fact, today it is when Rockefeller has announced this a new commitment to scale up equitable access to COVID testing in the country. Could you tell us a bit more about this announcement?
Thank you for the opportunity, Gargi. The Rockefeller Foundation is really excited to make this announcement. As you said, we're making an announcement, 5.5 million, which I believe is around 40 crore rupees, to CCAM, which is the Center for Cellular and Molecular Platforms, and the organization PATH. Together, we're making these commitments to help the government of India tackle the COVID-19 problem. Specifically, the grant to CCAM is to help the local manufacturer of reagents in India that is necessary for the RT-PCR tests. These RT-PCR tests are the gold standard for diagnosing COVID, and there has been a supply shortage, and we are helping CCAM allow the Indian manufacturers to create these reagents and testing kits that we hope will be deployed appropriately. And while we're doing that, we are also supporting PATH, the organization PATH, which is an innovation organization, a global organization that advances global health equity. We're asking them to work with the local governments and with the state governments, specifically Uttar Pradesh, Maharashtra, and Punjab, to see how can they come up with testing strategies that ensures equity. And so the combination of the supply chain and the reagents and the testing strategies, we believe together, will make an impact and allow the government of India to better tackle COVID.
Now, it's interesting that, the grants are to help ramp up the RT-PCR test, which is known as the gold standard, because there's been some amount of concern about over-dependence on the rapid antigen test.
So, Gargi, I just want to make sure that I put it in perspective. All these tests are important, whether it's for surveillance or whether it's for diagnostic. Antigen tests have a role to play. If you are trying to find out as a surveillance in a rapid way to find out what is the status and to root out any positives so that they don't further transmit the disease. So there is a place for antigen tests, point of care rapid antigen tests. But there is also a place for diagnostic tests, which is the reverse transcriptase RT-PCR test, which we are talking about, which is where there is a place for that. So there is a place for both the tests. And I just want to make sure that we're clear that in this instance, it is the RT-PCR that we are supporting. But Rockefeller as a foundation, for example, in the US, among schools, and how do we reopen schools? How do you make sure you get reopening of workplaces? There is a role for antigen tests. So we are also supporting that.
All right. Yes. So the tests are complementary, not competitive. Now, in your view, what have some of the big challenges been in scaling up testing in India?
Yes, India should be very, very proud of itself. It has actually increased the testing capacity by almost 30 times in the last 4 months. And that's a huge, huge increase in testing capacity. So it has really stepped up and done the right thing. However, when you look at a population of 1.2 billion, it's still a long way to go. And there were 2 challenges we saw, and that's why these grants are so timely from our point of view. The first was supply chain shortages. So these tests were dependent on imports, and the local supply chain, specifically with reagents, was lacking. And we looked around and we realized there's so much talent, so much capacity in India for self-sufficiency and not to be dependent on these imports. So we thought it would be appropriate to work with the Department of Science in India and the Ministries of Health and see, can we encourage local manufacture of these reagents? I mean, it's really, there are other parts of the world that depend on a lot of products that come out of India, whether it be vaccines, medicines. And so it was hard for us to believe that India was not doing more on testing because of supply chain and shortages of reagents. So the first grant is to see if we can encourage that and get the local manufacturer. The other challenge was equity and disparities. We saw that testing wasn't reaching, say, the urban and the rural. There was a big divide. Urban was getting a lot of the testing. We were not able to get the same level of testing on the rural area. So there were disparities. And that's when we brought in Pat to say, can we work with 3 states to start with, to put together some strategies that allow us to overcome these disparities. And once we do that, we can rapidly scale that all over the country. But how do we make sure that these tests are reaching the right population at the right time so that we can make the right decisions?
All right. Thank you so much, Dr. Naveen Rao, for speaking to us here at NDTV.